afternoon. I'm Julie Nauser, Dean at Research College of Nursing, and I would like to welcome you to today's White Coat Ceremony. White Coat ceremonies have been an important rite of passage at medical schools for nearly 30 years. The ceremony marks a student's transition to clinical practice. In 2014, the Arnold P. Gold Foundation partnered with the American Association of Colleges of Nursing to pilot the White Coat ceremony for nursing students nationwide. The following year, in 2015, Research College of Nursing held its first White Coat ceremony. Today, 83 accelerated BSN students will participate in the ceremony. Congratulations to each and every one of you. I would like to introduce to you Amber Boes, Chief Nursing Officer at Centerpoint Medical Center and a 2004 graduate of Research's Accelerated BSN program and 2012 graduate of the MSN program.
Well, welcome. I'm excited to be here today. You know, when they reached out to me to ask me to speak a couple months ago, I almost asked Rebecca, was it because my hospital is the closest to Arrowhead Stadium? But it turns out that they put distinguished behind my name today, so I asked if that meant I needed to act appropriate, and they said, of course not. They know me better than that. So, no, my hope today is to give you hopefully a little bit of words of wisdom of what it's like to be an accelerated option student. I sat in your seats about 17 years ago. That makes me feel old. I used to be the young CNO in the company. Now I'm just middle of the road. But I'm very, very excited to be here today. I'm very proud to be here because I am an alumni of the class that you're about to graduate from in a year, but also got my master's from Research College of Nursing. And I learned a lot about who I was as a person during my nursing program. The first reason that I did was because I encountered something very difficult when I was going into nursing school. And these guys know it well because both Rebecca and Julie were there at the time. My stepdad got diagnosed with pancreatic cancer 2 months before what you're going through today in your White Coat ceremony. We didn't have it back then, but before I started in the actual nursing program. And as you know, that's not a good cancer to have. Going into it, I had a previous degree in exercise science, and I thought, I'm going to graduate and do orthopedics or cardiac. And I changed my mind pretty rapidly once my stepdad, Denny, was in the hospital. He actually passed away 2 months after his diagnosis, and I was about a week into the program. The week before he passed away, he spent 5 days in a hospital, and I would tell you many nurses entered his room, and I think clinically they were probably all very strong. But there was one nurse named Karen, and she sat at the bedside. I might cry, sometimes I do when I tell this story. And she told my mom exactly what was going on in a way she understood. She held her hand, and she said it was okay to say goodbye. And that was something at the time none of us could do. And I've remembered that and what that felt like my whole career. Many times people ask me, did you know you wanted to go into leadership when you went to nursing school? And I say, no way. I did not have that ever in my mind. But what I found in myself as I became a new nurse on an oncology unit was I absolutely loved the patient care. I loved doing that. But somehow I kept getting tapped to do more. And the message I'm going to give you today is a message that I've been able to give a couple times to groups of nurses, and that's to just say yes. Every single group of people that have graduated from nursing school in the last 17 years since I graduated has thought, and these guys will tell you that, you're graduating at one of the hardest times in healthcare. And then we got a pandemic. And that really changed things for a lot of us and how we had to think of things. I would say I think I've always been a creative leader that was willing to make changes when it needed to happen. But during that time, we were changing things moment by moment to do what were best for the people that work in our hospital, but also for our patients. Throughout my career, when I was a new graduate, and my orientation had to get cut short because of staffing, I just said yes, and I figured out how to make that work, and I learned how to do it. You're going to have those opportunities in nursing school as well. The nursing student that is willing to do anything will get to do amazing things. I got to give medications that maybe typically I wouldn't get to give, but I got to go do those things. I got to experience watching the really critical patients go through things because I was the nursing student that said yes. So the nurses on those units would say, hey, I want to show you this. You seem really anxious to learn these things. And then when I was a new nurse, I became a charge nurse pretty quickly because they needed me to. And so I said yes, and I had that great opportunity to learn a little bit more about leadership. And then I became a night manager, and then a director. Eventually the ACNO at Research Medical Center. I did work there for 8.5 years. And then the CNO at Lee Summit Medical Center. You know, the thing about that hospital that taught me a lot was sometimes being a leader is more about listening than saying anything that you're thinking. And I was able to really listen to the community there and the culture and do some things that I think really made a difference for the staff because I was able to sit there and listen to what they were going through. Because when I go back to the story about Denny, what I constantly think about is my goal was to give nurses more time at the bedside so a nurse like Karen can hold someone's hand. I still talk about her 17 years later. Every other nurse I'm sure was great, but I don't have that memory in my mind. And so I continue to just say yes and listen to nurses because I think that's what's going to make the difference. And it also will enable you to do something that's so important as a student and then eventually as a new graduate, is to really listen to what your patients are telling you when you're there. When you're at the bedside, you're the person that they're looking to tell their story. And when you're a student, they're going to think you're their nurse. It says student nurse on your badge, but I tell you pretty much everybody that walks in the room they think of as their nurse. And maybe you can be the one to identify something or know they need more emotional support or maybe take the time to hold their hand during a time that they really need it. This school is going to do an amazing job teaching you the different clinical things that you need to know, all about disease process, but you're also going to be learning about yourself as an individual if you really pay attention to what they're telling you. I'm excited to be here. I hope they welcome me back. Usually sometimes I get to talk to you at some point during your curriculum, and I hope I have some more good stories to tell you and messages. And I will tell you, I'm all about mentoring and coaching and developing people. Don't ever hesitate to reach out to people that are willing to do that. And find the support that you need during nursing school. It is a strenuous program, but it's well worth it. It's one of the best decisions I ever made was to go to the Research College of Nursing back when I did. And I came out of it, I think, a better person and more understanding of what people go through. But the number one thing I would say is depend on each other as a team, because you will need that now and throughout your whole career. And eventually, when you look at the team you want to work with afterwards, find the people that you really connect with, because the team that you're working with is so much more important sometimes than the population you're taking care of. And that's a message I give to my family as well. My young cousin went through nursing school, and I let her know that. So really think about that as you're going through nursing school, is kind of that environment that fits best with you as a person. Thank you for having me here today. Thank you all, the leadership of Research College of Nursing, for inviting me, and congratulations.
Hello, everyone, and those of you that are watching streaming somewhere live. My name is Thad Wilson. I'm president of the Research College of Nursing, and I am a nurse. I just happen to have that other title, but always in the core of who I am is a nurse. So I just want you to know that when I come and visit with you, hopefully I'll get to see you in other settings, although some of you I've met vaccinating, which has been a lot of fun. That was a lot of kind of new things we didn't get to do. But I wanted to tell you why you're here today. As Dean Nauser shared with you, that this is the white coat's kind of new, but it isn't really that new. You see, back in the old days, when I graduated and before, every school had a cap that was unique to that school. You could walk in a hospital and you could look at a cap and you go, there's a research grad, or there's a grad from, and pick any school. When I graduated, you literally could look at a cap and you could tell not only where they went, but potentially when they went. It was a very identifiable type thing. But nursing took its growth in the profession, and we started getting PhDs, and some PhD prepared nurses found out that we carried on, you, not me, I never had a cap, you carried on your head this disease vector. So you would go from one patient who had some kind of infectious disease. Let's say there's something you've never heard of before called COVID. And that person coughed on your cap, and you go to another patient, and that person would then, that COVID would drip off your cap. So they outlawed caps in hospitals. Well, that took away a symbol for nursing. And in fact, if there's anybody here who has moms or grandmas or aunts, they'll tell you, you really should be wearing caps because caps are so important. Well, those caps, which were unique, you received those caps after you had completed the initial part of your education and you were ready to care for patients. And it would be a ceremony similar to this. You would go and they would actually put the cap on. It would not have the colored stripes on it, and that meant you were a probie, that you could now go take care of patients as a student, but they knew you were a student because you didn't have the stripes on it. And that cap actually was a symbol that people could look at and say, oh, there's a student. And I know that student is from Research College of Nursing because of the shape of the cap. And it was a bit of a symbol that was something that you carried with pride and could be taken away if you goofed up. Now, my aunt was a nurse, and why I ever became a nurse after hearing her stories from the bedside is beyond me, because every time we get together, her job was to gross me out as much as she could by telling stories about being a nurse. But when she was in school, you had to be a single female at her school. And one day she was caught holding hands with a boy. They removed her cap for a week. So she was in the clinical setting without a cap for a week, and she said it was the most humiliating experience of her life because the nurses in the unit would go, oh, aren't you in school anymore? Well, yes, I'm in school, but they took my cap away, and there was this like, you must have done something horribly wrong to have your cap taken away. I'm guessing that today that doesn't seem very fitting to you, and no, we're not going to take your white coats away. But it is a symbol. So we replaced the capping, the entry into clinical practice, with the white coat. So when you don your white coat today, it means that you accept the responsibility to care for a patient. Now, I know some of you have already had interactions with patients, but after today, there's an expectation that you are willing to accept that responsibility to take care of a patient who has put themselves totally in your care and generally in your environment. So it's kind of a big thing. And in addition to that, we will have you repeat an oath today. And in that oath, you will accept the responsibility as a student nurse to care for patients, to be honest and truthful, to do the things that you're supposed to do. And that's why we have a white coat ceremony. It's for you to accept the responsibility and for us to lay upon you that authority to care for patients. So let's get to it, shall we? I'd like to introduce Dr. Saxton, who will actually give the presentation of white coats. Dr. Saxton.
All right, we'll begin with the first person. Gershom Allen Aqua. Emmanuel Omatayo. Lisa Luck. Jake McDonald. Asif Ali. Jake Liston. Shanice Bailey. Julia Brannon. Anna Bakhtel. Alexis Bertrand. Jennifer McCoy. Lisa Fox. Kelly Akimoto. Hannah Bateman. Brooke McManus. John Berry. Delaney Bottoms. Margaret Harrington. Salvador Hernandez II. Tisha Hayes. Beth Herod. Erica Hammond. Jessica Green. Mary Alessandra Garcia. Madison Cunningham. Benjamin Costello. Anna Colagrossi. Daly Klein. Aaron Clemens. Cameron Carlson. Sable Campa. Brianna Bartosh. Diana Bologna. Cole Kenny. Samuel Langer. Adam Sklamberg. Samantha Fields. Jordan Lindsay. Russell Walter. Melissa Lowry. Paige Fraker. Haley Gant. Victoria Blez. Allison Lemke. McKenna Nolan. JC Garcia. Amy McCollum. Brittany Korth. Lauren Jewell. Abby Ewert. Paula Santibanez Pacheco. Shanika Prendergast. Lauren Letterman. Ruben Inwale. Isabel Kemp. Riley Davis. Zukra Abdukalikoya. Amanda Larison. Alex Prestovich. Christopher Datar Newbert. Lindsay White. Lindsay Page. Alicia Yount. Abby Davis. Katie Padilla. Rachel Evans. Risha Shelton. Chi Obafor. Taylor Reyes. Tiffany Pinkerton. Michaela Johnson. Taylor Wolken. Starla Ely. Hannah Warren. Alexandria Wells. Nathan Schrader. Heather Seaton. Brooke Jones. Rachel Johnson. Julia Johnson. Nicole Ryan. Kristen Soykan. And now, Dr. Nauser.
Wow, you guys look sharp in those white coats. Congratulations. We will be reciting the oath, but we have many of our participants are getting their picture taken. So maybe this would be time to review a little pathophysiology. Not very good at humor, I know. Yeah, this, as Dr. Wilson was describing, this really is a really wonderful acknowledgement of the transition that you're making from the classroom experiences to actually being able to take care of patients. And that white coat does symbolize your professionalism and your commitment to provide the highest quality of care. So we are just so pleased as leaders at Research College of Nursing that you have taken on that commitment and you are willing to be the face and the future of nursing. So I would like for everyone to please stand. We will be reciting the oath. If you could grab your card, we're going to read through that together. As a nurse dedicated to providing the highest quality care and services, I solemnly pledge that I will consider the welfare of humanity and relief of suffering my primary concerns, act in a compassionate and trustworthy manner in all aspects of my care, apply my knowledge, experience, and skills to the best of my ability to assure optimal outcomes for my patients, exercise sound professional judgment while abiding by legal and ethical requirements, accept the lifelong obligation to improve my professional knowledge and competence, promote, advocate for, and strive to protect the health, safety, and rights of the patient. With this pledge, I accept the duties and responsibilities that embody the nursing profession. I take this oath voluntarily with the full realization of the responsibility with which I am entrusted by the public. Again, congratulations. This does conclude today's 2021 ABSN White Coat Ceremony. Thank you for joining us. And if you will please be seated for further instruction. Thank you.